Nice to hear
Sal, good morning.
How's my favorite financial people doing?
We're doing great.
Just great.
We're actually happy to be your favorite financial people, too.
Always.
Exactly.
Well, you're my only financial people.
Well, like I said.
We're happy to be that as well.
We are privileged.
Here's my question. I saw President Trump on the news about a week ago, maybe 2 weeks ago, but they were talking about doing something with the benefits for pharmacy, drugs.
Right, on Medicare.
Yeah, is there anything coming down the pipeline? They're killing me with this thing right now, with this donut hole, man. I'm telling you.
Well, I know we had to send Sal back to work just so he could pay for his prescription.
I think he went back because...
Yeah, I need to know.
His wife wanted to get him out of the yard because he's getting too sunburned.
Well, I do that, yeah.
Well, Sal, a couple of things. I know Trump has talked quite significantly about having the Medicare be able to negotiate prices with drug companies, and I don't know how soon anything like that would happen because that's a pretty significant change in how Medicare currently works. However, what is happening, and this is through the Affordable Care Act, and because the Trump administration did not actually repeal the entirety of the legislation, the only thing that the Affordable Care Act really did for Medicare is begin to close that donut hole. So by 2020, if nothing has shifted significantly with the Affordable Care Act in terms of the legislation, that donut hole will close by then. So every year, it's still going to be painful for a few months, but it should be less this year, less next year, and then it will be completely gone by 2020.
That means keeping more of your dough.
That's exactly right. Keeping more of your dough.
Sal, we do appreciate your call, and by the way, happy weekend and to you and your family. So thanks so much for calling. Okay, bye-bye. We do have Rick has a question on line 3. Rick, good morning. Welcome to the show.
Good morning. Happy Memorial Day weekend to you both.
Thank you so much.
Just wondering, I'm 64. We'll be turning 65 next April. And I know you probably answered this question a million times, but do I have to sign up for Medicare when I turn 65?
Do you currently have health insurance through an employer or your spouse's employer?
Actually, both.
Both. Well, then no. You do not have to sign up for Medicare as long as you have what's considered qualified coverage, which you do through your employer and your wife's employer. When you decide to either leave your employer or leave your employer and your wife also leaves, then that would be the time in which you sign up for Medicare.
And you really don't want to sign up beforehand, do you?
No, especially you're already in a situation where you have primary and secondary coverage, primary being yours and your wife's being secondary. Medicare is not going to pay anything on your claims because the way that it works is your coverage is primary, your wife's is secondary, and then Medicare would be, I guess, tertiary. I don't even know of a third what the third level is, but what happens is when you go into the hospital or you have a claim submitted, first your coverage pays what it is required to pay, then it's passed on to your wife's coverage. They'll pay whatever they say they'll pay, and then when it's passed to Medicare, Medicare's only going to pay the difference between 80% of the value and what you paid. So if both of your coverages paid more than 80% on the claim, Medicare's not going to pay anything. So it doesn't make a lot of sense to pay the government $134 a month for the coverage until you actually need it, which would be when those other two coverages drop out.
Rick, I hope that helps.
Sure does. Yeah, I was for some reason was thinking that you had to, and I really didn't want to. So I appreciate your advice, and like I said, I hopefully stay with both programs as long as I can there, and not bug the government there.
Yeah, I mean, and then what happens is when you get close to that time that you're deciding to, once both of you are losing your coverages, because obviously you'll both be covering each other one way or the other, give Erin a call. She'll be happy to help you make that transition.
Absolutely. No penalties involved.
No fees either.
No fees or penalties. That's how we like it.
Well, and I would just say this generally, whether, obviously Erin knows what she's talking about, can help folks make the transition, but people should be using...
not anyone, but people should be using qualified professionals.
Absolutely, because there's no cost. And also there is no cost in terms of visiting with someone and having them assist you, but at the same time, there's no discount for for buying a supplement, whatever it would be, without using an agent.
Going direct does not create any discounts for you, and the nice thing is, if you are working with a professional that's well-versed not only in the plans that they're discussing with you, but Medicare enrollment periods and Medicare itself, then you can avoid costly mistakes when you are transitioning off of your coverage.
Yeah, this is one of those times when there is a thing as a free lunch. And you should take advantage. You should certainly take advantage of it. It really is in your benefit to do that.
And people think that's too good to be true, but the reality is the insurance companies are paying people like myself and others to be their marketing arm. So that's the way that we're paid, is through a commission through the insurance company when you make that decision.
Plus all the time you save. Oh, my God.
Exactly. Like, you don't have to look up all these policies. You don't have to look up to see if your physicians fit, if your prescriptions fit.
You don't have to go to these stupid lunch seminars?
Well, see, with Medicare, you're not allowed to have lunch.
Oh.
You can only have yogurt. You can only have light snacks at those presentations, so they're not even as fun.
And generally, when you're doing that, they're also only one company specific. They're not necessarily even specific to you.
That's right. There's the Medicare salesmen have two different types of events that can be held. One would be informational, where they don't discuss products at all. That's simply discussing what Medicare is, what your enrollment periods are, and how you can make those transitions, what the options are, but no specific benefit comments. But then also there are sales presentations hosted either by companies like Coventry, United Healthcare, Essence, and they have brokers that put those presentations on. Well, if it's an Essence presentation, you're only going to hear about Essence. If it's Coventry, the same thing. So when you're only listening to one option, you're really limiting yourself, because the great thing about Medicare is usually there is something that will fit everyone.
That's great. And I know that, one service that we do provide, we as in you get to do all the work.
Well, thank you.
Is with companies in terms of visiting with them, helping their folks that are getting ready to transition do a really nice generic presentation on how Medicare really works and how you make that transition.
That's right, because HR is very important when you're at the company, but what happens when you leave, and that's really where we try and help pick up in terms of what are your options, what do you do.
Which is fun, and frankly, having a real sense of security, because you're getting the knowledge of being able to make that transition, is probably like the number one, number two thing that most retirees face in terms of trepidation, if you want to call it.
Right, how much is it going to cost? What do I need to do? I've heard all of these different competing answers. It's nice to have someone that's willing to be accountable for the answers that they give you.
Well, again, it's great to have coaches that do that.
Exactly.
That are available to you. Again, our phone lines are open. We'd love to hear from you. 969 KTRS, star KTRS from your cell phones, or